Hi everybody, this is Dr. John Hayes. I'd like to welcome everybody to today's show. Today we're going to be speaking with Tim Kaufman. Tim is a physical therapist here in Pembroke, Massachusetts, and Tim has really a great background. Tim, welcome to the show.
Thank you, great.
Of course, yeah, no, it's a pleasure. You know, you have a really wonderful background. Would you take a couple minutes and tell our listeners a little about yourself and what you've done and what you've accomplished, because it's pretty impressive.
Yeah, sure. I went to physical therapy school at Boston University. It was a great education there. I got some good opportunity to learn about PT and get some good residencies through them, and the residency training was great. I got an opportunity to go down to Alabama and work with some top-notch sports medicine doctors and therapists down there at Champion Sports Medicine. And you know, after that, came back to the Boston area. I've been working for a few years. I was up in the Wellesley, Natick area, and now I'm down here in Pembroke. We just opened a new clinic, Long Pond Physical Therapy, opened their second location in Pembroke. The first location has been open for a number of years now down in Plymouth, and the Pembroke location is now open right on 139 in Pembroke. We've been open since about November.
Okay, and what types of, you have a general physical therapy practice? Do you have specialties, or tell us a bit more about your practice?
Outpatient orthopedics, so any orthopedic injury, muscle joint, tendon, ligament, it's outpatient, so you have to be able to get there.
Right.
You know, so you're able to travel, but we take all ages from the very young, from babies all the way up to the elderly. But in general, predominantly, you know, knees, shoulders, back pain, neck pain, ankle sprains, muscle pulls. You know, also post-surgical rehabilitation. If you have a knee surgery, knee replacement, hip replacement, that requires some physical therapy after you've been discharged from the hospital, after you're back home, and still need to work on some of that range of motion, some of that strength. That's the type of treatment that we do.
Now you have a background. I mean, obviously being a physical therapist, you do a lot of exercise training, a lot of rehabilitation, as most of us do who have done physical medicine. And you know, we were talking before the show about, you know, our age group who suffer from neuropathy and chronic pain are usually, not always older, but you know, usually older. And what I thought would be very helpful today is if we could just try to paint the picture a little bit, because you and I both know that there is this misconception out there, which I've spoken about before on the show, that as we get older, certain things are normal. You know, you're supposed to put on weight, you're supposed to slow down, you're supposed to not exercise so much, or you can't do this, you can't do that. And I think you and I probably come from different schools of thought on that. So, or we have some of those schools of thought, but our listeners probably have different. Right, exactly.
Yeah, it is a common misconception that people slow down, but I think it's, you know, exercise is good for and safe for just about everyone.
Right.
Even the elderly, even people with arthritis, even if you have high blood pressure, even, you know, some of these other even serious health consequences like heart disease. It's actually, exercise is good for those type of things.
Right.
And sitting around and not moving enough and not being active can actually make things get worse and make it harder to move around. And start to impact your just daily functional things. Right.
So let's take for example let's take a patient who has, let's just pick chronic pain. Let's just pick a general term. Maybe they have some arthritis. Maybe they have had a surgery or two, and it has deconditioned them, slowed them down, and so on and so forth. Let's talk about things from a general perspective. First of all, what you folks may actually do in the clinic, and then talk about getting patients on the road to self-sufficiency.
Sure, yeah. In the clinic, you know, we're going to focus on addressing any impairments that are there. So, is there pain? First of all, we want to try and control pain. Is it pain? We try and find out where the pain is coming from. Is it an inflammation, swelling problem? Then we can do some treatment like ice or electrical stimulation or ultrasound, things like that. Is it, you know, a tightness problem where we need to stretch you out, massage, mobilize joints? So we're trying to address the pain and allow you to control that, but we got to find the cause of the pain. So sometimes sometimes it's a weakness, and we've got to strengthen muscles to support a joint, or stretch something out that's too tight that's giving you pain. And so our treatment's going to evolve into stretches and strengthening as things go on. And we try and focus everything back towards function. We know that in research, if you train functionally, you're going to get better at doing functional things. So
yeah, let's talk about that a little bit. What do you mean specifically about function and training people into function and that type of thing?
Right. So if we're choosing an exercise to strengthen, say, your leg muscles, we're not just going to go ahead and pile on a lot of weights or anything like that. We're going to try and do something that mimics your function. So if you have to walk upstairs, we're going to do something that's going to mimic stairs to a certain degree to strengthen your ability to walk upstairs.
Okay.
If we practice in therapy, we build strength, and then you'll be able to, when you go home, you'll climb up the stairs with a lot more ease, with less effort, better strength.
Okay, good. So really what you're trying to do, as we both say in the clinic, is to get people more functional in their ADLs, activities of daily living,
Exactly,
and that type of thing too.
Yep.
Okay. Well, Tim, this is good. This is really good material. And when we come back from the break, ladies and gentlemen, we're going to be talking again with Tim Kaufman from Long Pond Physical Therapy, right up the road here in Pembroke. And where's your office once again?
We're at 31 Scoosett Street.
And how can our listeners get in touch with you?
You can go to our website, www.longpondpt.com, or call us on the phone.
Okay. And your phone number is?
781-924-5289.
Excellent. Thanks so much. You're listening to Video Neuropathy and Chronic Pain here on 95.9 WATD. We'll be back shortly.